It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.
Well, welcome back. And Hoag Medical Group, they've been bringing us some fine doctors and other people on our show every week. And we have another one today, Dr. Richard Cow. He is a diplomat with the American Board of Family Medicine. Nice to have you on.
Oh, thanks for having me.
And you've been with Hoag just a few months.
Yeah, I actually recently graduated for residency. So I trained in family medicine, and I trained over at Harbor UCLA in Torrance. Recently graduated, started with Hoag in August. Just tell a little bit about myself. I actually grew up in Orange County, in Irvine, in fact. I went through the middle school, high schools there, and then ended up going to Stanford University for my undergraduate education. Went all the way to Brooklyn, New York for my medical school training at SUNY downstate. But I definitely wanted to come back to Southern California. That's why I came back here to Torrance to do my training. And I really wanted to go back to my hometown, Irvine, and try to give back to the community as much as possible as a family physician. And so I was very fortunate in finding the Hoag Medical Group.
Oh, good. I'm glad to have you back here. You certainly went to some award-winning schools, that's for sure.
Thank you.
Yeah. You want to talk a little bit about today, about diets.
Yeah.
And what makes up a healthy diet. And also talk about all these kind of different diets that come out, every week, it seems to be. And it gets very confusing for people. What's your overall take on these different diets and the ones that have come up over the years that we've heard, like the Atkins diet and things like that?
So, I mean, before I start, I do want to talk about nutrition and a balanced diet, if that's okay.
Sure.
So, I mean, there are a lot of different diets out there, but people might not realize what makes up a healthy, balanced diet. And so there are actually 3 nutrients that we need, that we get energy from, and those are sugars, proteins, and fats. And so a little bit about each one. So with sugars, you just want to make sure to limit the amount of sugars and the types of sugars that you take in. And so we get sugars from fruits and vegetables.
Right.
And also grains or bread products, right? Yeah. And so you want to pick the right ones to eat. I don't know if you've heard of the glycemic index.
Yes.
Glycemic index, that's been in the news pretty recently. And so that's just been come about around the 1980s. But it's been more popular recently. And basically what we do is someone eats something, and then we measure their blood sugar a set amount of time afterwards. And so what we like to say is you want to replace high glycemic index foods with low glycemic index foods. So high glycemic index foods would be something like pizza, pancakes, things very processed sugars and grains. Low glycemic index foods are very natural foods that you'll find in the supermarket, fruits, vegetables. And so if you do that, you actually, for the same amount of food, you take in fewer calories, feel fuller, and actually get more vitamins and minerals in your diet. And so that's with sugars. Now with proteins, you just want to make sure you eat a variety of lean proteins. So this includes lean meats, like fish and poultry, eggs, some dairy products, nuts and seeds. And you want to try to keep away from like red meats and processed meats, which have a lot of saturated fats. That's been in the news too, different types of fats, and that's a third component of a balanced diet. And so you've heard about like trans fats, saturated fats.
Yes.
And so those are things you want to try to steer away from because they have been linked with coronary disease, heart disease. And so another thing you want to try to replace with a more unsaturated fats, which people, it has been in the news a lot too. And those are things such as in fish and olive oil and nuts and seeds and those type of things. So if you replace those, you can actually limit your risk for heart disease.
Okay.
Yeah.
And what was the third one? You had the protein, the sugars.
Sugars, proteins, and fats.
Okay.
And those three, you get most of your energy from.
Okay, the saturated fat, yeah.
And then along with that, you want to make sure you get enough vitamins, minerals, and some fiber in your diet.
Okay. Well, as I stated before, all these different diets have been around for years. The Atkins diet, you know, that goes the low carb diet.
Yeah.
There's one now I've heard recently, I can't think of the official name for it, but it's the don't eat any kind of legume diet.
Oh, well.
And, you know, the theme that I hear from most people like you is that it's eating more of the good things, less of, not so much the bad things, but things that aren't quite as great for us. But, you know, eat everything, but just, you know, make sure that that plate that you have, they've come out, you know, with that new, they used to have the pyramid, now it's more of a plate, is you fit what that model is, depending, of course, on your lifestyle.
Yeah, so with a plate, it's more about the portion sizes. Trying to control your portion size, which is very important. You know, going through medical training and residency, we also hear about a lot of these diets. You said the Atkins diet, the low-fat diet has been around for a long time.
Right.
Mediterranean diet, you've probably heard of too. You eat a lot of the olive oil, the nuts and seeds and things. And even like vegetarians or vegan diets, those have been around. I feel like they come about as a way to promote a healthy lifestyle. But I think people focus on using those to lose weight, and that becomes a little bit of an issue. It's great to change your diet and you know, to try to lose weight and eventually become healthier, because you know, obesity has become an epidemic in the United States with growing rates in adults and also in children. And it's been linked with heart disease, diabetes, high blood pressure, and even certain cancers. And so trying to lose weight is definitely a good idea. But people focus on these diets and they go through them. They do lose weight, which is great, but then they go back to the regular diets, the regular food, and then they end up gaining back that weight or even more. Where the important thing is to try to create some kind of lifestyle change. Right. And so you can pick small things out of these diets, which is fine, you know, but pick small changes that you'll be able to maintain for your lifetime, and that's what's important. So make small changes, collect them together into creating a lifestyle change that you can maintain, and that's how you become healthy.
And what is the role that someone yourself plays within that with your patients?
Well, so you know, I work with the patient to see what their lifestyle is like. I get an inventory of what kind of things they eat, you know, what time they eat them, the amounts that they eat, foods that they prefer, certain tastes that they might like, and also definitely, you know, if they have any medical conditions that can affect the way they eat. So those are all things that they'll ask at the very beginning. And then we'll come up with goals together with the patient. You know, what are they trying to achieve? Are they trying to get slimmer, trying to lose weight, or do they just want to, you know, fight back that high blood pressure, or you know, lower their risk of heart disease because they have a family member who's had a heart attack before? So, you know, doing all those things, seeing what their goals are, and then creating a plan, incorporating those little changes will eventually build up to big changes and affecting lifestyle change, so that the patient can become healthier overall.
Yeah, just basically common sense, right?
Common sense things, but it's very hard to do. That I found through my training. It's the hardest thing to get patients to effect some kind of behavior change.
I think that is. Well, you're with Hoag. Are you out of here in Irvine or Newport, or both?
Oh, so I may work out of Irvine.
Okay.
Irvine office is on 4900 Barranca.
Okay.
But there are several other offices, one in Irvine and Woodbridge, one in San Canyon where the hospital is, and also the first hospital in Newport Beach. We also have locations at Huntington Beach, Aliso Viejo, so multiple locations.
Okay, if someone is interested in speaking with Dr. Kao, he again is with the Hoag Medical Group, and there's the number that you can contact. You can go online to Hoag Medical Group, and there's the number on the screen. That's the main number there to their medical group, 791-3101, and from there you can ask. Now, I should mention, if you're interested in this doctor, Dr. Richard Kao, because his brother, who's been on the show before, is also a doctor with Hoag and internal medicine.
Yeah.
So you might want to, make sure to go by his first name as well. But it's a pleasure to have you on.
Oh, thank you very much for having me.
All right, maybe we'll see you or maybe your brother again, or get you both on sometime.
Sure, yeah, that'd be great.
Okay, we'll be back in just a moment. Very good.